Good day to everyone. My name is Nico Marco Gagolinan. I am from De La Salle University in Manila in the Philippines, and I would like to share with everyone the findings of my study entitled Analysis of College Students' Insights from a Mental Health Literacy Webinar. Now, I would like to share with everyone a little bit of a background about my study. From the World Health Organization in the year 2022, they defined mental health as the state of mental well being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. It is an integral component of health and well being that underpins our individual and collective abilities to make decisions, build relationships, and shape the world we live in. Looking at the Philippine tertiary education perspective of mental health, it is interesting to see the juxtaposition of lights and shadows. Recent studies indicate that Filipino college students have an average level of mental health literacy. However, they were also observed to have above average psychological distress and heightened anxiety levels. Likewise, it has been noted that they have insufficient knowledge of causes of mental illness, how to seek and avail professional help, as well as evidence based treatments. Functional knowledge of mental health, known as mental health literacy, has been identified as a potent tool in protecting against mental health distress and facilitating well being. According to Jorm and his colleagues in 1997, mental health literacy refers to knowledge and beliefs about mental disorders that aid their recognition, management, or prevention. Mental health literacy includes recognizing specific disorders, knowing how to seek health information, knowledge of risk factors and causes, self treatments, professional help available, and attitudes that promote recognition and appropriate help seeking. Noting, however, that mental health literacy is not mere knowledge, but something one can take action on to improve one's mental health or those of others, Jorm and his colleagues in 2012 refine the components of mental health literacy, which now encompasses letter A, knowledge of how to prevent mental disorders, letter B, recognition of when a disorder is developing, letter C, knowledge of help seeking options and treatments available, letter D, knowledge of effective self help strategies for milder problems, and letter E, first aid skills to support others who are developing a mental disorder or are in a mental health crisis. Mental health literacy helps young people recognize signs of psychological illness, appropriately seek help, and avoid potentially harmful reactions. Likewise, increasing mental health knowledge decreases discriminating behaviors and attitudes toward people with mental health problems, and in turn increases confidence in reaching out to people experiencing psychological distress. Ultimately, this lowers mental health related morbidity and mortality and hastens recovery time. On the other hand, recovery process is hindered by lack of knowledge about symptoms of mental illness, where to seek effective treatment, not taking mental health problems seriously, and help seeking preference for religious leaders and those who practice faith healing, all of which are associated with insufficient knowledge and awareness about mental health concerns. For mental health literacy interventions to positively affect mental health, however, individual at the individual and community levels, Kutcher cautioned that these should be developmental, context appropriate, and adequately evaluated. While mental health awareness sessions have been deemed effective in raising mental health literacy, what the participants actually learned and valued was seldom explored. If college students are to truly benefit from these activities, knowing what they gained from participating in such sessions would be essential. The current research aims to fill this gap by investigating student perspectives after attending a mental health webinar. In particular, the following questions will be pursued. What did college students learn from the mental health literacy webinar? What learning did college students find most helpful? What would college students want to learn more about mental health? themes representative of the insights shared by the participants, what they learned, what they found most helpful, and what they would like to learn more about mental health are discussed as cognitive, affective, and behavioral gains. In order to answer these questions, I made use of the qualitative design following the phenomenological approach, which involved intuiting, analyzing, and describing human experience and perspective. The informants are composed of 33 Filipino students enrolled in a college program in the current year, all of whom were studying in a private urban university at the time. Mail, social media account announcements, as well as personal messenger was used in order to invite potential participants. After attending the 2-hour webinar, the participants were asked to fill out a survey form. The mental health literacy webinar the college students participated in covered topics adopted from JORM's Mental Health Literacy 2012 conceptual framework. In particular, mental health related terms were defined for the participants. The mental health continuum was discussed, a network of people to seek help from was explained, and a short list of evidence based treatments, coping strategies, and self care practices were reviewed. First aid skills were discussed in a manner college students would easily remember and apply. An open forum where the participants freely asked questions and clarified their ideas closed the webinar. For the research instrument, a researcher made evaluation divided into three parts was placed in an online form and distributed to the participants. The first part outlined the purpose of the evaluation, including the data privacy, confidentiality, and informed consent statements. The second part asked for the respondents' demographic information, all of which have already been de-identified. And the third and final part contained the activity evaluation and descriptive survey. For the descriptive survey, the students answered 5 questions concerning their insights about the webinar and their mental health needs. Among these questions are included the three research questions for this study. What are my insights or learnings during the mental health webinar? What learning from today's talk would help me most? And what would I like to learn more about mental health or the topics discussed? For data analysis, the responses of the students in the open-ended questions were coded and themed using Brown and Clark's thematic analysis method. Analyzing themes is a foundational approach to conducting qualitative research. Clark and Brown in 2016 proposed 6 phases in thematic analysis. The process involved getting familiar with the data, generating codes, searching for potential themes, mapping the themes analyzed, and defining and naming the themes and producing a report which involves the selection of representative statements to the themes that provides the narrative that best responds to the research questions. At this point, I would like to present and discuss the study's findings in an orderly manner. Notably, the themes identified from the insights shared by college students after attending a mental health literacy webinar will be shared as cognitive, affective, and behavioral gains. Looking into the first question, that is the learning gained by college students through the mental health literacy webinar, we can find under cognitive gains two themes: the importance of mental health, which primarily concerns itself in terms of understanding that mental health is complex and that it affects other facets of life, and practical application of knowledge gained, which is about knowledge of the range of help available and the variety of professionals who can be tapped for different levels of mental health concerns. In terms of affective gains, the themes observed were self care and communication. Self care stood for the realization of valuing and protecting one's mental health, especially through rest, and communication, on the other hand, covered responses related to opening up and being ready to listen to others. Finally, for behavioral gains, the themes identified were the skills necessary to foster well being, which involved building
and practicing habits supportive of mental health, and skills to support others, which included responses pertaining to creating strategies that are inclusive in order to reach out to others. For the second question, what learning from the webinar did college students find most helpful? In terms of cognitive gains, the following themes were identified: understanding mental illness and the importance of professional help. The informants found most helpful knowing the causes and underlying factors of mental illness, signs and symptoms of developing mental illness, and not self diagnosing and seeking the help of a professional. In terms of affective gains, the following themes were identified: feeling emotionally supported and being sensitive to others. Responses for feeling emotionally supported revolved around realizing that it is okay to not be okay and to understand that mental issues are quite common. In terms of sensitivity to others, the responses are primarily centered in terms of the importance of doing welfare checks for others and doing this with kindness and sensitivity. And for behavioral gains, the themes identified were steps to care for self and to provide support for others. Responses for steps to care for self involved effective coping, doing self checks or evaluations, and steps to better manage stress. And finally, support for others covered responses related to how to provide mental health accessibility and how to evaluate the mental health of their peers. For the third and final question, what would college students like to learn more about mental health? In terms of cognitive gains, the themes understanding specific disorders and learning about approaches on helping people with specific concerns were identified. The responses were primarily rooted in the participants thinking that they have observed psychological or mental health concerns and conditions amongst their peers and having the desire to be of assistance to them. For the affective gains, empathy and solidarity were the themes observed. Responses primarily revolved around growth in understanding of one another, support for each other, expanding consciousness about mental health in the community through open discussion. And finally, for behavioral gains, the themes identified were coping strategies and measures on how to prevent mental illness. The responses are primarily centered on coping with stress, time management, and proper care for the mind and body. In conclusion, based on the themes gathered from the informant's responses, after participating in a mental health literacy webinar, college students learned the value of mental health and the importance of professional help. They gained an appreciation for self care and communication, as well as skills necessary to foster personal well being and how to help others. College students likewise found understanding mental illness and effective help seeking as their most helpful learning, being emotionally supported and emotionally supportive as their most helpful realization, and knowing how to care for the self and providing support for others as the skill most helpful for them. Finally, college students would like to learn about specific disorders and learn about approaches on how to help people with certain conditions. They would like to foster empathy and solidarity better in their communities and further develop coping skills and habits that prevent mental illness. All of these findings find resonance in previous studies that mental health literacy increases effective help seeking through professional diagnosis, understanding of self treatment, as well as first aid skills to help those with mental health concerns or those experiencing mental health crisis. We can likewise observe from the themes gathered that the informants developed a destigmatized attitude and behavior towards mental illness and an increased willingness and confidence in helping others. These are concordant with findings available in the literature. In view of these, mental health literacy activities should be continued and developed into a program. Other topics aligned with mental health literacy can be developed for college students to accommodate their needs for more specific mental health topics. Similarly, for college students, self-care and mental illness prevention, talks on empirically based approaches to stress management and coping can be offered. Variations in delivery of the activity may be explored from talks to small group discussions. In close coordination with mental health and student affairs professionals, students can be encouraged and guided to start their own mental health initiatives with their respective groups. Student led mental health initiatives um, could advance discourse and involvement, increasing mental health literacy and mental health outcomes among the youth. And with that, I end my presentation. If you have any questions, do not have any second thoughts reaching out to me through the email shown on the screen. Thank you very much. Maraming salamat.